This video discusses about the femoral triangle. Femoral triangle is a superficial triangular area located in the anterior upper thigh, and it's an important anatomical landmark because it provides passage for major neurovascular structures entering and exiting the lower limb from the abdominoperineal region. It has three boundaries. Superiorly, inguinal ligament made the superior boundary, and then laterally, medial border of the sartorius muscle make the lateral margin, and medially, medial border of the adductor longus. You can see to this femoral triangle, the adductor longus muscle itself included. So we take the medial border as the medial boundary. Flow of the femoral triangle made out of four muscles. More superiorly, iliacus contributes, and then psoas major. So we can collectively tell as iliopsoas. Then the pectineus muscle, then the adductor longus. So if you are asked what are the muscles lying in the floor of the femoral triangle, you can tell there are four muscles: iliacus, psoas major, pectineus, and adductor longus. Roof of the femoral triangle made by the fascia, superficial fascia containing superficial lymph nodes, great saphenous vein and its tributaries, and the deep fascia, fascia lata, also contribute to the roof of the femoral triangle. Now this deep fascia pierced by the great saphenous vein at the saphenous opening. You can see here a sheath-like structure which is the femoral sheath covering the femoral artery and the femoral vein, and then there is a canal-like structure placed most medially. So we'll discuss what are these structures in the upcoming slides. Femoral triangle contain major neurovascular structures as I mentioned. So most laterally placed the femoral nerve. You can see it is not included into this femoral sheath. It is located outside the femoral sheath. And then between the femoral nerve and the femoral vein, we have femoral artery, and most medially the femoral nerve. So here the femoral canal and also deep inguinal lymph nodes also contain of the femoral triangle. Femoral sheath. What is the femoral sheath? Actually, it's a prolongation of two fascia. When the femoral artery and femoral vein enter into the femoral triangle beneath the inguinal ligament, it draws two fascia around themselves and make a funnel-shaped fascial structure. Anteriorly, femoral artery and vein draws the transversalis fascia, and posteriorly the psoas fascia. So the femoral sheath made out of transversalis fascia and psoas fascia, and femoral sheath fuses with the adventitia of the artery and vein about 3 centimeters distal to the inguinal ligament. So the femoral nerve is not contained within the femoral sheath. Only the femoral artery and vein contains in this femoral sheath. And you can see a very medial structure here. It is the femoral canal. We'll see what is it. Femoral canal is the most medial part of the femoral sheath. It's small and almost vertically placed cap, approximately 1.25 centimeter in length. In females, pelvis is bit larger, so femoral canal also tend to be larger than male counterpart. And because of this reason, femoral hernia are more common in females. In the femoral canal, it contains a lymph node, a node of the femoral canal or Clockett's gland. It drains lymphatics from the clitoris in females and glans penis in males. So what is the femoral ring? Femoral opening is the femoral ring, and it also has four boundaries. Anteriorly, the medial part of the inguinal ligament make the anterior boundary, and medially it has the free edge of the lacunar ligament. Lacunar ligament also a triangular expansion of the inguinal ligament. Then laterally have the femoral vein and posteriorly the pectineal ligament. So these are the four boundaries of the femoral ring. What are the functions of the femoral canal? So it acts as a dead space for expansion of the distended femoral vein, and it also facilitates for the lymphatic pathway from lower limbs to the external iliac nodes. What is the clinical importance of the femoral canal? Femoral canal is a weak point in abdominal wall and it can give rise to femoral hernia. Abdominal viscera or omentum can pass through the femoral ring into the femoral canal. So this femoral hernia usually never due to a congenital sac, but rarely it can happen in children. When the femoral hernial sac enlarges, it emerges through the saphenous ring. Neck of the femoral hernia located below and lateral to the pubic tubercle. We can differentiate it from the inguinal hernia where the neck lies above and medial to the pubic tubercle. Due to the narrow neck and the medially placed lacunar ligament, irreducibility and strangulation is more commoner in femoral hernia. Thank you. Stay tuned with Anatomy Everywhere YouTube channel.